All right. Thank you, everyone, for joining me today. My name is David Brackett. I'm the founder and CEO here at Linguava, and we're doing the series of on-call healthcare interpreters, which really highlights what is it like to be a healthcare interpreter, what is the role of the interpreter, and how to better utilize meaningful language access at each step of the way. So today I have the honor of sitting down with Nando Magallanes. Nando, thank you so much for joining us.
Of course, thank you for giving me the time to do this interview.
Yeah, appreciate you being here. Really excited to learn more from you and a little bit of your story. Before we jump into some more of the professional questions, we're going to ask you just a few more personal icebreaker questions to get to know you a little bit. Starting off with, when you're not interpreting in the language access space, what is a hobby that you like to do?
Just being outside, whether that be like going on walks with my dogs or playing to pick up soccer like I did yesterday after a couple appointments that I had. That's about it. Like I like staying active. I feel like that's what helps me just decompress after like a long day of interpreting and a long day of work.
Awesome. Wonderful. And what would you say your favorite food is?
I'd be biased and I'd have to say lomo saltado. It's a Peruvian like beef stir fry, just because like you can eat it with about anything. You can eat it with rice, with French fries, with spaghetti. You can put it in a burrito. So that's one of my favorite foods for sure.
Sounds delicious. That sounds good, man. Making me hungry already. And then if you could learn another language outside of, say, Spanish and English, what language would you learn and why?
This might be kind of what you don't expect, but I'd want to be proficient in Lusoga. It's a language used in Uganda mostly.
Okay.
Yes.
Okay, and why that language?
A big reason why is because I was just there actually for about 6 weeks. First week I was doing a clinical experience, so I was volunteering at a local hospital. In the last 5 weeks, I was able to do some research on a school discontinuation project. So essentially, like why kids are dropping out and like what psychological impacts that they're facing due to that. And it was a great experience because I was actually working with like not necessarily interpreters, but I was also like with the American fellows. I was working with Ugandan fellows, so they were our interpreters when we were conducting the interviews, and it was a great experience. Like not being in the middle of the interpretation, but like actually having to use one, you know. So that's a big reason why I think I'd be proficient. I'd want to be proficient in Soga, so I could go back there one day and help out like as best as I can.
Beautiful. Well, I'd love to learn more about your experience there for another conversation. And I'm sure that was a really rich experience.
100%. Yeah, it was a great one.
Yeah, and last question for you before we get into the professional questions. If you could snap your fingers and go anywhere in the world right now, where would you go?
I think I'd go to Japan. Japan is really good. Like the food there is really good. I'm a food fanatic, I would say. I really like to try a bunch of different foods, and like that's the one region I feel like I haven't gone to yet. Like Asian countries, and Japan is definitely one of my top targets over there where I want to visit.
I'm right there with you. I love Japanese food. I would probably pick the same place. Never been to Japan. It's definitely on the bucket list. So excellent. Well, so Nando, just jumping into some of the more professional questions. Tell us, how did you get started as a healthcare interpreter?
It's been a kind of a long journey. It started for me, I would say. So I just graduated from college. I just finished my senior year, but it started for me like my winter break of my freshman year. And the way it started, it was because one of our family friends, kind of a do-it-all type of guy, like he's a car mechanic, he knows how to like change bathrooms. He's also a medical interpreter, and like he knew about like just the path I wanted to go on. Like I want to one day start practicing to be or start training to become a physician, go to med school one day. And he knew about my goals that I had in mind, and he told me about the job that he had as medical interpreter, and he thought it'd be a great opportunity for me. And he just gave me like the first exposure I had to like any type of medical interpreting or just learning about medical terminology was the Des Moines medical terminology training online course that I took in English and Spanish. And once I took those and like realized, I was like, okay, like this isn't too bad, like took the time to study it. And I was like, I felt like I was pretty good at it. Like the following summer, it was sometime like after sophomore year, junior year fall is when I started taking my 60-hour training course with OHCIA. And then the following summer, junior year summer, is when I started fully practicing, which was last year.
Wonderful. I love that. And when you first got started, what was it that surprised you most about being a healthcare interpreter?
Honestly, how natural it was, because like I remember being very psyched out before my first appointment. I was like, this is like honestly like my first big boy job is what I would say.
Mhm.
You know, like before this, I was like working at Costco, and I was like I'm really working with people, working with patients. You know, like their outcomes kind of depends on me. You know, and at first like it kind of psyched me out, but like I remember like before going to my very first appointment, like I just told myself, I'm just helping these people, you know, I'm helping my patients, I'm helping the providers, and that helped me like really just calm me down, just ground me to like what I'm really doing, like what my purpose there is, just to help give better healthcare to my patient, you know.
Yeah, yeah, no, that's beautiful. It's such a, like you said, direct correlation to their health outcomes. You know, you being there as the bridge, as the conduit. What would you say is the biggest misconception of the role of the interpreter? That could be from the provider side or even the patient side.
Mm. That we're just translators, because a lot of people call us translators, you know, that we're just there to um like obviously we're there to interpret everything that's said, but like
Mhm.
I feel like there's a reason why we're not called medical translators, but we're called medical interpreters, you know, because like it's not every situation we can translate every single word like word for word, you know, like we have to like use our cultural knowledge and to like be able to like extract the correct information from the patient and the provider to be able to and communicate that to either way.
Mhm. Yeah, yeah, no, exactly. There's certain words or phrases that they don't have a direct um translation per se, and so there has to be, as long as that the message is being conveyed, right? The
Mhm.
same message can be said possibly in multiple ways.
So
And what would you say something that really drives you personally as an interpreter? What is it that gets you out of bed in the morning to be able to do what you do?
honestly, just like the satisfaction I get from like every appointment that I come out of, you know, like, and out like there's definitely varying levels, you know, like sometimes they're very like quick appointments, just like post stops or just yearly follow ups or like monthly follow ups for like newborns and stuff. Like those are pretty simple, like, you know, like they're not super crazy. But like the ones where um like there's like two main ones I can think of. Like one time I was in an appointment where um this patient I was there the patient was there with like three other family members, and essentially like they had just gone like through a whole round of
Mhm,
like chemotherapy radiation, but this is like after like 2025 administration, you know. And essentially like the whole conversation, like the whole interpretation appointment was about like how they needed to get another round of like of their care, but they had to do it in another country because of just the situation in
mhm,
of where we are right now, you know. And it was like just amazing to like see how the provider was able to work with the patient to
mm,
like try to get access to the care that they needed in another place, in another country, and just like being able to be there to like bridge that communication. Like I felt like just super grateful to be able to help that family, help the provider like get that patient like the care that they needed so you know they could
yeah,
have better outcomes. Like
yeah,
that's just one example. I've countless examples too, to be honest. But that's just I would say like that's the main one off the top of my head. Like after that one, I was like, I'm glad I was there to be able to help that patient. Like I felt very, very happy. So I'm ready for like any every day. Like you know, it could be a simple one, or it could be one that's like high stakes like that. You know, so I'm just
mhm.
being an interpreter. Like you gotta be prepared for anything. But I feel like that's something that really drives me. Just being able to like truly, really like help patients
Yeah, it's
every
truly a
every appointment.
life-changing role that you play as a healthcare interpreter. And how do you prepare for that, knowing that, like you said, you could walk in any given day and there could be any topic, that some of the really high stakes appointments to more of a basic checkup. How do you prepare mentally for those kinds of assignments?
Mentally, I would say like on the emotional side, like just like how I said before, like just really not expecting anything and just understanding like anything can come my way, any type of
Mhm,
appointment can come my way. And like in terms of like mentally being sharp, like I like it's really nice being able to see like what department I'm able to be in, like in the job description. And then like I just honestly like, you know, me being a college student, I used like AI has been a very great tool to me. And like I've used AI in my interpreting jobs as well. Like before, just like give me a rundown in English and Spanish and medical terminology and like on uh of an appointment in like in this certain department, you know.
mhm. Yeah,
And they give me a
great
big
things.
rundown in like a table format, just like Spanish and English medical terminology regarding that department. So that helps me a lot. It's definitely helped me prepare for countless appointments. They helped me yesterday too in an appointment where I had to interpret about pre-op for hidradenitis suppurativa, like the very first time I've heard of that procedure, you know, but AI also helped me like prepare with some medical terms before that. So that was
No,
great.
that's great. That's good information. So yeah, when you go in, you've already been able to get some good research in a short period of time before going in. And for Nana, for the last question for today, what message would you have for other interpreters out there, whether they're current interpreters or maybe even for interpreters that are people that are thinking about getting their training and becoming qualified or certified? What message do you have for them?
I'll say two. Like my main one, like I already said it, like it's a very rewarding job. Like every appointment, I feel like I come out like just knowing like I was able to help a patient receive better care, help a provider provide better care. You know, so that's something like that truly drives me, and I feel like if people are really interested in like patient care and just building relationships with people, working with relationships, working with people, you know, that's the main thing I would tell them, that it's just a very rewarding job. You're always interacting with different types of people, meeting different types of people, and just the great way to build your network as well, you know.
Yeah.
And then second, I would say it's like every day is a learning experience. Every day, like you're learning something new. Like you can't just expect to finish that 60-hour course and like expect to know everything. Like every single day, you're learning something new. You gotta write down your notes. You gotta like recap of what you learned that day, so like you can already be prepared if like that nature of appointment comes up again. You're already prepared for it because you've already done it before.
Yeah, that's beautiful. I love your approach of just being open, not having expectations going in because you don't know what you're walking into many times. So I appreciate that message, and I'm sure that's gonna really resonate with a lot of people in our interpreter and healthcare provider community. So Nando, again, thank you so much for taking the time to meet with me today and learning a little bit more about your story, and hopefully we can connect in person here sometime soon.
100%, yeah, that'd be great. But yeah, thank you for taking the time to do this. It's been a great experience.
Thanks so much, Nando. All right, we'll talk soon.